Hello and welcome to another episode of PodcastDX, a show that brings you interviews with people just like you whose lives were forever changed by a medical diagnosis. I'm Lita. Rana's not with us today.
And I'm Jean Marie.
Collectively, we're the hosts of PodcastDX. On today's show, we are speaking with Dr. Raina Mafee. Dr. Mafee is dual board certified in Neurology and Integrative Medicine. She is passionate about using functional and integrative philosophies to help treat and prevent a number of chronic health conditions. Dr. Mafee has a particular interest in treating those individuals diagnosed with neurodegenerative disorders, like mine. Mm-hmm. Hello, Dr. Mafee. Thank you for joining us today.
Thank you for having me.
And I think we're going to end up pronouncing your name 12 different ways throughout this episode, so I apologize.
Did I say it wrong again?
I think so. It's Mafee. Mafee?
Mafee.
Mafee.
Okay,
Mafee.
Well, hello, Dr. Mafee. This is Jean Marie, and I'd like to start by asking you what actually led you to a career in medicine?
I had a family with a lot of doctors in it. So I kind of had a lot of, encouragement from that end. And I just had just an inclination. I always felt, inclined to do something more in the sciences. And I was always just more inclined to, things related to healthcare. So I kind of knew from an early age that I wanted to be a doctor.
Sure. That's great. Yeah. That's great. I'm sorry. Go ahead.
Okay. And Dr. Mafee, what are integrative and functional medicine? Are they kind of the same thing, or are they two completely different fields?
I get that question a lot. So there are some differences. So integrative medicine is, a broad sort of a way to kind of refer to how to intermix different modalities that doctors aren't traditionally trained in a traditional Western medical school setting. So, whether it be incorporating acupuncture or traditional Chinese herbs or Ayurveda or, intense nutritional therapies, you can call yourself an integrative doctor if you're kind of blending some, I guess you could say, East and West, or, other complementary and alternative philosophies with your traditional medical training. Whereas with functional medicine, I think of it as, having training and using a different sort of like GPS system or roadmap to be able to kind of help optimize health and treat a lot of chronic illnesses, because it's founded and rooted in a lot of like systems biology sort of medicine. So trying to get at, looking at that one particular individual, what are their particular individual needs based on their whole health. So looking at, all the aspects of health, hormonal health, metabolic health, immune health, gastrointestinal health, and so on, trying to kind of look at all the different nodes of health and decide what best suits that individual. And in functional medicine, a lot of integrative modalities are used. So intense nutritional therapies, different herbs and supplements, and so forth. So they are different. A lot of times they are interchanged, but there is a difference between the two. Yeah. So when we talk about neurodegenerative diseases or disorders, it's a very broad kind of category or term to refer to any disorder that causes destruction and tissue death within the neurological axis or neurological system. So whether that be brain related or spinal cord related or nerve or muscle related, there are different types of neurodegenerative diseases. So if we start at the top with the brain, Alzheimer's disease, other dementias, Parkinson's disease, those are things that, would be considered neurodegenerative diseases because there's tissue destruction and death in certain, areas of the brain. If we talk about, nerve-related disease, things like motor neuron disease or, ALS, that might be considered in that category. So that would be a neurodegenerative disease as well. So it's just basically just a broad term to kind of refer to any kind of disease or disorder that will cause tissue death within the neurological axis.
Okay. All right. And how does your approach to treating neurodegenerative disorders vary from a typical mode of care?
Well, our system, our traditional medical system is very oriented in naming it, blaming it, taming it. So naming the disease, kind of figuring out what it's called, and by that time, it's usually progressed pretty far because a lot of neurodegenerative diseases take several years, sometimes decades, to kind of creep up on somebody before they start to really overtly show symptoms. So naming it, blaming it on, on something, and then taming it with usually a medicine or a surgery or a procedure or something like that. So that's the traditional sort of approach. Whereas using a wider toolbox, if we use a functional medicine approach, an integrative medicine approach, we have a lot more things that we can reach for, so things that aren't really considered as heavily in, a traditional Western medical model. So really, working with people foundationally in terms of lifestyle and getting, diet really honed in, because food is medicine. There's no question about that. So using diets therapeutically, doing some more in-depth testing, oftentimes is what I'll do to kind of investigate what some of the root causes might be for whatever neurodegenerative disorder, patients, dealing with. And investigating, all aspects of health. So I'm really passionate about, like fixing people's guts, because there's a huge connection between the gut and the brain and the nervous system. So oftentimes I am doing a lot of testing with gut and kind of targeted treatment towards gut sorts of things. But then again, based on what the individual needs are of the patient, they may be more, we might need to work more on, metabolic health or, detoxification and, reducing toxic load and so forth. So it all depends on the patient.
Dr. Mafee, and I'm sorry if I mispronounced it yet again. I recently read a study from the National Institute of Environmental Health Sciences concerning pollutants and toxic metals as possibly being the blame it or the cause of neurodegenerative disorders. Is this something that everyone should be aware of as far as risks go, or is this just something in one more thing in the whole gamut of possibilities for, the result, or for causing neurodegenerative disease? Sorry.
So certainly, there's actually a lot of mounting evidence that toxins in general are seeming to be a contributor to neurodegenerative diseases. So in the beginning, when I started kind of learning this approach and this style, I was really impressed with the data on, like Parkinson's disease and the effects of things like pesticides and insecticides and heavy metals, because there is some good evidence showing that there are links. Not to say that it is the cause of Parkinson's disease. It's a very complex illness with, I'm sure multiple etiological factors, but there is good evidence to show that things like insecticides, pesticides, and heavy metals are partially to blame. So, and over the years, evidence has been also mounting similarly to implicate, similar toxins in Alzheimer's disease, in ALS. So, I think a common tie of most neurodegenerative diseases is that the cells in the nervous system, aspects of the cells, I should say, the little energy factories in the cells, the furnaces of the cells, they're called the mitochondria. So they become dysfunctional. So those are really, really critical to help to keep those cells very vital and alive and thriving. And when the mitochondria become, broken and dysfunctional, the cells start to die. And oftentimes the common link here is something called oxidative stress. So there's like a rusting on the cells. There's like this oxidative stress that causes these mitochondria to kind of become less efficient and ultimately to cause cell death. And so a lot of these toxins in our environment are showing to be, mitochondrial pollutants, to be toxins to our mitochondria. But there are also other, reasons for why toxins in general cause ill effects. So they can have direct effects on our immune system. They can dysregulate our hormones. They can dysregulate our metabolism. So a lot of reasons why toxins in general, are to blame.
Okay. That makes a lot of sense.
Wow, that's incredible.
Well, and I'm curious, what type of testing can be done to determine if a person has, like, you had said that it can take a long time to determine that someone has a neurodegenerative disease, but is there specific testing that can be done to determine if someone has a neurodegenerative disease?
Not, I wish I could say yes, oftentimes these, like the symptoms that come on are insidious, so very slow. So like, let's take Alzheimer's, as an example. So there may be some slight, very subtle signs and symptoms of memory issues, cognitive issues that creep up, 10, maybe even 20 years before the onset of the diagnosis. There's no real test for, am I going to get Alzheimer's disease? There are some genetic markers that might make you more prone to develop something like Alzheimer's disease. Something like Parkinson's disease, there are some very rare genetic, predispositions for that, but oftentimes it's something that comes on without a family history. And it's, there's no direct test for it, but, I would say if you are concerned about it and let's say you have some kind of occupation where you're maybe at higher risk, like you're a farmer and you work with a lot of pesticides, it might be, to your benefit or worth, kind of meeting with a doctor who practices the way that I do. And, even though you're not showing any signs or symptoms, just to make sure that, everything looks good, like nothing, there are no warning signs of illness, and that, all sort of the aspects of your health are kind of kept in check.
Okay. And I guess also you'd be establishing a baseline at that point.
Right.
Okay.
Yes.
Well, doctor, what are some elements of wellness that most people overlook that might help us, avoid?
So I would say, with I would say the two things that are kind of on the top of my brain with that question. Number one would be diet, because, we in our Western society, we are, eating what we call a SAD diet, the standard American diet. Not everybody, but a lot of people, with, fast food on every corner, and, just it not being stressed as much when you go to see just your primary care doctor. It's just not really taught and ingrained in medical school that doctors should really be like heavily counseling their patients on healthy diets. And I personally even think that, like diets that are recommended, that are like through the Food and Drug Administration, like I don't think that the standard diets that are recommended as healthy are even the best guidelines. So, like having a really paying attention to diet, having a really anti-inflammatory diet, which, the most data shows that the Mediterranean style diets there's a lot of good, strong evidence that those are very, very good diets in general. But diets, in my opinion, need to be very personalized. So depending on, the person and their needs, there's a lot of ways to make nuanced changes to the diet recommendations. So diet, I think, gets overlooked for sure, but also stress is a big factor, I think, that gets kind of overlooked in terms of wellness, and people don't take as good care of themselves, don't know when to set limits, don't know when to say no, get too overwhelmed, get overworked, don't sleep enough. So, I think self-care and just, not being too stressed, I think, is something that gets overlooked.
The two very important factors. And, doctor office visits nowadays are so quick. You're in and out. You don't really have a lot of face time with your doctor. So, maybe there could be an augmented segment of medicine. Maybe the nursing staff could be the supportive role for those type of things, like maybe
for integrating, having a nutritionist,
right,
consult and other things as well. Yeah, if you think about it, the human body is so complex,
right?
And you guys have a lot to deal with.
But that's one of the reasons that we did this podcast, is because we realize that your FaceTime with your doctor is very limited nowadays.
Right, and anything we can do to make that that time as valuable and as beneficial as you can is great.
Right. We try to give people advice on, or suggestions on how to plan their visit with the doctor so that they can get the most bang for the buck. Right. And people probably don't want to hear
that they have to do a lot of the work.
That they have to do the work themselves.
Yeah, at least like documenting symptoms and things of that nature. But I have an unusual question. Because you're using functional and integrative medicine, in addition to being a board-certified neurologist, does that affect how your office handles billing and insurance?
So we do we do kind of work on a cash-based model. So it's a fee-for-service model. However, we provide super bills to patients so they can submit to their insurance for reimbursement. The reality is that, our current healthcare system and insurance model doesn't support, as you kind of alluded to, the type of care that's needed to really deal with complex chronic illness if you want to kind of address the whole person. So it takes a lot of time. Our visits are lengthy, and we spend a lot of face time with patients. I can't remember the last time I only had a 15-minute encounter with a patient. So for that reason, I think most doctors that practice functional medicine are kind of leaning towards this sort of practice model.
Okay.
Yeah, because insurance companies want you to spend so much time, and it's
and they're restrictive.
Is limiting. Yes,
they're restrictive.
It is. And I mean the saying health is wealth. Nowadays, you really have to invest in yourself and your own health. Right. And I think definitely, finding a physician such as yourself who's going to take time to actually get to know you and it's fantastic.
Yeah, definitely.
Personally, on a personal note, what helps you find a good work-life balance?
Oh, well, not working full-time and burning myself out. So I work part-time because I have a family. I have 3 kids. So it would I would not practice what I preach at all if I were, working myself into the ground. So working part-time, spending time with family as much as possible, having some time out for myself for self-care. Those things I think are what keep me in balance and in check.
I bet every doctor that's listening to this is thinking, wow, that sounds
that's
great.
a great plan.
let me jump over there.
Well, and we have noticed that a number of people that we interview, we want to know, like, do they have more hours in the day? Because it seems like everyone just is accomplishing so much and taking on so much.
But it's got to,
you have to balance it.
Yes, right.
Okay.
And what is the best advice that you've received as far as treating someone with a chronic neurodegenerative disorder?
Well, these are very complex chronic illnesses, and oftentimes patients are told they're untreatable. For the most part, you can abate symptoms with medicines and procedures and so forth. So just showing a lot of compassion, and spending as much time as is needed with patients to kind of answer questions and be available, I would say is, that's probably what I'd say.
Well, that's great. And that's something that you in your practice. Chosen practice can do, whereas a lot of doctors can't.
Right. And I think with a neurodegenerative disease, especially, you really do need more time.
Right.
To take everything in and yeah. Okay.
Yep. Yeah, I'm definitely leaning.
Yeah, you're scheduling an appointment as soon as we get off of this call. Yes.
How have your family and friends supported you while you were in medical school, your residency, and in your career?
I'm very fortunate. I had a very supportive family. I started my family in my residency. So I had loving parents, loving in-laws that helped, in the beginning when I was just doing traditional medicine, I had a hospital job and I was on call often and it was long hours. So I did have a lot of support in that way. Not everybody's as fortunate, but, like I said, it just worked out that way.
That's great.
Yeah. And what tips or advice do you have for new medical students and those just finishing up with their residencies?
Oh, boy. Well, I think my experience is not the same as the experience of current residents and medical students because they've changed policies on hours. And I mean, the hours that I worked were insane. So if I were to go back and talk to my previous self, I would say, just take care of yourself. Make sure you sleep enough. Sleep is so important. Eat well. Don't eat crap, a healthy diet, enough sleep, and, do things to just take care of yourself, whether it's going on a meditative walk or, like taking time out to just breathe, just take care of yourself.
That's great advice for everyone.
Definitely. And doctor, what would you say the biggest challenge has been so far in your career?
Oh, probably striking that work-life balance for sure. And I had a couple of years where I took off. I just didn't work at all because, I went from working full time and having 2 kids and getting burned out, so, and I needed a break for myself. I just needed to turn it off, so I turned it off for a while and then I figured it out. I figured out how to go back and kind of keep a balance. So finding that work-life balance was a journey, it took even taking time off for a few years.
Oh, okay.
Yeah.
Oh.
And I didn't put this in the script, but I'm just curious, what led you to neurodegenerative diseases?
Well, I wouldn't say that I went into neurology just to kind of deal with neurodegenerative diseases. I had an interest in neurological issues in general. So that's what led me to do that residency. But, in my training with, integrative medicine and functional medicine, I just started to realize more and more how instrumental this sort of approach is specifically for neurodegenerative diseases.
Okay. All right.
Yeah.
Good.
Mhm.
Well, now we're going to do our tips, hints, and tricks lightning round segment of the show.
Yeah, kind of like a game show.
Sort of, yeah. So 10-question lightning round, Doctor. Are you ready?
Sure.
Okay. Why is the brain important to you?
Oh, the brain is important to me because it's your thinking organ, it's like that's what makes us human. It's what sets us apart from other animals and primates. And it's important, that's what makes us human.
Yes. Good answer. 10 points.
Okay. And what makes life easier during COVID?
Spending time with family, and friends safely as much as possible.
Oh, wonderful advice. A wonderful answer.
And what is your go-to online resource for medical information?
Oh, PubMed, probably.
Okay. Yeah.
Good answer. And do you have any tricks for dealing with stress?
Yeah, one thing I do, which bugs my husband, but I set an alarm on my phone twice a day, just to remind myself to take a few minutes out to just breathe, take some deep breaths.
Okay, that's a good answer. And what do you always bring with you when you go to a doctor's office?
Probably just a list of questions, just make sure that I remember to ask everything I wanted to ask.
Yeah, because when you're there, you can get overwhelmed or
Yes.
get off. That's
Yeah,
a
we
great
always
answer.
advise people that we're interviewing that if you don't write it down, once you're in there, you may forget what you wanted to go in there for. As a matter of fact, I was just at a doctor and I forgot to ask because I didn't write it down.
So now it's on her calendar.
Yes.
Reminder to ask.
Okay. What do you do? Or excuse me. What do you use as a distraction during long waits? If you have to wait for a long time.
It's a bad answer, but my phone.
Yeah, I think everybody does nowadays, right? It is.
It's a little CPU. So
It is.
Yeah, definitely.
And what is your fast and easy nutritious snack?
Go-to snack.
Yes.
Probably a handful of nuts, like almonds or walnuts, or sometimes I'll make a little trail mix with, pumpkin seeds, maybe almonds or walnuts, raisins, and maybe a little dark chocolate.
I call that GARP.
Yeah.
That I call that GARP, GARP. I used to make that for my kids whenever we did a long road trip. I would mix it, like a trail mix type thing. Okay. Give us 3 of your favorite recreational pursuits.
Well, I love yoga. I've been doing yoga for about 10, 11 years. Through COVID, I started doing a little more Pilates, like mat Pilates. So that, what else? I like to ride the stationary bike. So I like cycling. And I'm recently getting into pickleball.
Oh, I've heard of pickleball. Haven't seen it, but I've heard of it.
I'm picturing a little pickle, like little tiny cucumbers flying through the air.
Yeah. What animal best reflects your personality?
I don't know, something gentle and friendly, maybe a dolphin. I don't know.
Okay.
I like that. I like that. And what do you do to treat yourself?
Oh, I love getting a pedicure.
Okay.
Once in a blue moon, I'll get a massage for myself. And just spending time with friends.
That's wonderful. You did a wonderful job with our little game show there. And I have a question. How can we learn more about you and your practice?
So going to our website, so www.case, C-A-S-E, integrativehealth.com. We're also on Facebook and on Instagram as well as Case Integrative Health. That's probably the best way to learn more.
Okay.
Super.
Sounds great.
I am definitely going.
Yes.
I didn't realize that you did, because we interviewed a colleague of yours,
Regarding
while back.
Yeah, regarding Lyme disease.
right. But now that I know that you do this particular aspect of health, I'm going to be a patient because I have been.
I'll be happy to see you.
Yeah, I've been dealing with some memory problems for quite a number of years, and they can't wrap their head around it, and I'd like somebody to try to help me. Well, I think that wraps up this episode. Thank you very much for taking the time to talk with us today, Doctor.
Thank you. It was a pleasure.
And a special thank you to the PR agent, Alexandra Moresco. She's set us up with a couple of interviews from your staff. If any of our listeners or have any questions or comments related to today's show, they can contact us at PodcastDX@yahoo.com, on Facebook, Twitter, Pinterest, or Instagram. And we have a website, PodcastDX.com.
And if you have a moment to spare, please give us a review wherever you get your podcast. As always, please keep in mind that this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment and before undertaking a new healthcare regime. And never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast.
Till next week.